My name is Ramsha, and I'm an incoming PGY1 resident at White River Health. I've had quite a few. I went to med school with some of my best friends, and we had the most amazing time. If I had to pick one, it would probably be, I remember the exact date, it was October 24th, 2021. There was this big cricket match, and we ended up having a screening for it on campus at school, and we all stayed back. And it was during exam season, so we were trying to get some studying done in the middle. And we won that game. It was a big historic game, and to be able to, this was one of the last years of med school, and to be able to enjoy that and celebrate later with some of my best friends, that was probably one of my favorite memories. I think it was a combination of something that I was passionate about, was interested in, and also thought I could be really good at. I had great love for storytelling. I thought that was something I could find in this profession. I love meeting new people and getting to hear about the stories of their lives. I was also raised with a great sense of public service, and so having a role to play in maybe improving some of those stories, that was something I was interested in. And then I was just really good at biology, and not much good at anything else, especially math. And so it was a combination of a bunch of things, I guess. My first job was I did an intern year before coming here back in Pakistan.
Okay, what was it? Just medical?
Yeah, it was just medical. 6 months of medicine, 6 months of surgery. Didn't like the surgery too much. And that's why I'm in internal med. My favorite holiday is probably New Year's Eve, because I was born on New Year's Eve. It's also my birthday. And so it's great to watch the fireworks at night and also celebrate during the day with family and friends. It's always a good time. And I'm always off. And I hopefully will be this year too. Love that. Thank you.
You're welcome.
I always go for an iced mocha everywhere. Simple. I love chocolate. I love coffee. I love the combination of the two. The best advice I've ever received is probably, it was actually something I read recently, is to never let a problem to be solved become more important than a person to be loved. Problems will come and go. Crises will find a way to resolve themselves. All time, no matter how difficult, will pass. What does live on, though, is the love and grace we are able to show to each other when we're at the bottom of the pit. It is very easy to be a good person when life is nice to you. But who are you when it isn't? Because that's who you really are. And that's something that I've had to learn, especially over this transition period in the last few weeks. And so it's something that I think I'll hold very close to my heart. Chocolate chip cookies. So I had this one recently doing one of my rotations. This was this elderly lady, and I had a lot going on that morning. I walked in to pre-round in her room, and she was in a lot of pain. And the nurse practitioner came and gave her her PRN Dilaudid dose, and I thought her pain was going to resolve, but she was alone and she was waiting for her husband. She started crying. And I had a lot of notes to do. I considered for a second, I think she'll be fine, but then made the decision, because she was alone, to sit with her and hold her hand. In that moment, while I was sitting there, she started desatting. She started overdosing on the Dilaudid she was given. And only because I was there was I able to recognize it, and we were able to call for help, get her oxygen up, give her a naloxone, and take prompt action. And so it was a moment of kindness and empathy that probably ended up saving her life. And so that was probably something I'm always going to remember.